What's your go-to pain medication for these scenarios?
In the emergency situation, opioids are what we, hydro, buprenorphine for cats, hydro for dogs is really helpful. Get them what they need. Post-operatively, surgically for me, in my hands, I really like to kick my patients out of the hospital. I don't like them hanging around. Most of them are neurologically stable and can go. And so for me, sending them home, I tend to use some sort of NSAID if they can tolerate it for whatever reason. There's no, if they haven't gotten steroids in the emergency situation, you got to watch for that a little bit. And gabapentin right now, that's what I reach for. So NSAID and gabapentin as I send them home. Once they get their parts put back together, they're so much more comfortable if things aren't banging into each other. So really, we fix them up, kick them out the door, and keep our eyes on them or checking in on them frequently. But that's my choice. So whoever you spend time talking to, your dentist or oral surgeon or surgeon you spend time with, we always love heads up. We don't want to stress our own selves out, but we like to kind of know what's out there. At least I think we do. So call and see. Yesterday, my partner and I, we were sitting there working together. We were doing dueling tables, and we got 3 phone calls for different versions of emergencies, right? And your brain goes, okay, how are we going to figure this out? So we were, doing the mental math about where we're going to put these patients. And we chatted with them. Turns out none of them had true emergencies. We can schedule all of those. Dental care, dental emergencies, dental stuff is often more an urgency than truly an emergency. So just give them pain meds, give them a muzzle, phone up your friend, and see what they say. And they might say, send the dog home overnight. We'll help them tomorrow. Or they might say, right now, come right now. They'll help guide you. I hope that answered the question. Other types of urgencies and emergencies where you really have to get in there are some of these hemorrhage situations. And you guys, it can be very obviously inspiring of chaos when you see all of this bleeding that's happening. But like the surgeons always told us, all bleeding eventually stops. And in the mouth, that's true too. So it can be very tempting, or you can feel like, oh my gosh, I got to get them sedated, or go ahead and ligate these vessels that might be bleeding. Truth be told, most of the time in the mouth, it will stop on its own with just calming down and putting them in a kennel, putting a muzzle as long as they're not at risk for aspiration if you need to. Those kinds of things can be very helpful in dealing with hemorrhage. Dental emergencies are often trauma related. And with that in mind, triage is always going to win over a dental emergency, right? We get phone calls all the time at night about a patient or a case. But it's very rare that I have to actually come in and do something because these pets need to be stabilized anyways. So if that patient comes in, it doesn't have to derail your day. You can put a muzzle on it. You can put them in the kennel, assess their pain, support them, take your time to get some radiographs if you need, or assess their systemic health or the overall health. Don't worry so much about the muzzle and the face. If they're mentally aware, that's fabulous. That's really step one. And the rest we can help with time. We can help with time. Okay.